Do you ever feel like the problems of the world are too big or too far away to be able to fully understand? Or is it sometimes hard to relate to issues that other people face around the world? Or maybe it is easy for you to relate and you're just curious about what is happening around the world. Well, I'm Stephanie Jacobs, the person behind Love Light Stories, where we create space to explore different perspectives on social issues through real, uplifting, and positive stories told by real people. And I often have the opportunity to work with a lot of different nonprofits and talk with people in that space as well. And because of this unprecedented time, I decided to be able to share some of those conversations with all of you so that you can have a better understanding of what's happening too. So I just got done talking to Steve Stirling at MAP International. He's the president there. And this is an organization that you might have actually heard of already through Love Light Stories or other places, but they're one of my favorite organizations. I've worked with them for quite a while now. And I just love what they do. And really, it's a combination of the fact that they are very, very efficient. They serve over 10 million people in over 100 countries with really only about 40 staff members, which is incredible in itself. But the ratings for their efficiency ratings and things, they are getting perfect scores in places like Charity Navigator. And things like that. But on top of that, the organization itself and the people is what I really, really love. They are stellar at building relationships, and I always truly feel filled up after talking to someone at MAP. And I hope you have a chance to maybe catch a glimpse of that in this video. But Steve himself has an incredible story too that we share a little bit about in this video, but there's more on that as well. But this video specifically is sharing just a background about MAP and then what they're doing right now in this COVID-19 crisis. They were one of the first to respond when all this broke out in Wuhan, China, and they continue to respond around the world, but also in the United States. So Steve gives us a glimpse into all that, and this is just an incredible organization, and I'm excited for you to watch. It's just a pleasure to have you on here today. Thank you for making some time to talk. I know we've really been able to build a relationship with MAP, and I have as well in my family over the last year or so, and I've just come to love what you do. And so I wanted to bring you on here and chat more because there's a lot going on in our world right now, and I want to learn more about that. So before we jump into that, can we just have a little bit of background on your story and how God led you to MAP?
Sure, I'll be happy to. And thank you, Stephanie, for having me on your show on Loving Life Stories. I really just a pleasure to get to know you and your family. And it's been almost 6 years now since God brought me to MAP. And initially, I really didn't want to come to MAP, but then my wife's encouraged me to look at MAP. And then I realized, and you met me, so you know I have crutches and leg braces, so you can't see me with my crutches here. But since I had polio when I was a baby, and when I was 5, I was abandoned in an orphanage, and then at 10, I was adopted. And so I came to America, I had just a second chance in life. And but having had polio, I'm reminded every day that a 60-cent vial of polio vaccine would have prevented me from having polio. And what MAP does is that MAP gets medicines and health supplies donated by pharmaceutical companies. The products they're not expired yet, but they're getting close to it. And so then we accept it, and then we raise money, and then we use our partners to ship them all over the world. Literally, we touch roughly over 10 million people every year with life-saving and also health supplies. And so when I saw what MAP does and does it so efficiently, I realized that God had prepared me for the role. So each we have the purpose of serving 10 million people around the world, providing them with life-saving and oftentimes saving medicines. You know, things like for chronic diseases like hypertension, cardiovascular, asthma, and diabetes medicines, and also medicines for antibiotics and simple things as analgesics and whatnot, oral rehydration solution as an example. So those are the products that we provide. And during disaster response, like right now, we provide all different types of protective equipment and other disaster health kits for people in disaster situation.
Yeah, and Steve, I know that you serve a lot of people. It's an astounding number with the small number of staff relatively that you have. Can you share a little bit about some of that? Because I think it's really powerful.
Right. The WHO estimates there are 2 billion people in the world that do not have access to life-saving medicines. It's 2 billion. And so MAP, we are very efficient. We have about 40 people in the whole organization, and about 30 of our staff are in Brunswick, Georgia, which is close to two deep water ports, the Savannah, Jacksonville, and also Charleston's not too far away. And so those 40 people in total were able to acquire, store, distribute medicines all over the world through our partners on the ground. And we ship containers. Most of our medicines go out in containers on ships. That's the most efficient way to distribute these medicines. And then also we help support medical missions teams, doctors and church teams that go on medical mission trips, and they take the medicines with them when they travel. So in total, we're in about 100 countries. And MAP is so efficient because we get these medicines donated, over $500 million worth of medicine donated, that if somebody donates $10, that will help provide $840 worth of medicines. So think about that, $10, $840, because we get 99% of our medicines we get donated from organizations, very good pharmaceutical companies in the U.S. and also from Europe as well.
Yeah, and when I think about just the dollar value of that is incredible, but the life-saving value is even more incredible in how these medicines literally can be something as simple as an antibiotic that we take for granted here, and that there just isn't, it's not available in some of these countries unless you're able to bring it in. So I think it's just incredible what you're doing.
That's right. And, we obviously, everybody's right in the midst of the COVID-19 response and the pandemic around the world. And yet, as sad as it is, and I think I heard today in the U.S. about over 47,000 lives have been lost through COVID-19. And that is tragic, and I don't want to undermine that. But if you look at the total number of people that die because they don't have clean water, and the number one killer of children under the age of 5 is diarrhea and upper respiratory infection. Antibiotics and oral rehydration solutions will help to prevent that or to cure it. And so these poverty children dying from, and adults too, from chronic diseases like hypertension and diabetes, the numbers are in millions and millions of people dying every year. And MAP is privileged to be able to help some of those children and adults passing away from diseases that you and I don't have to worry about, because we have medicines in the United States to help prevent and treat those chronic diseases.
Yeah, it's incredible. And so shifting to what's going on in the world right now, what's happening in the countries that you ship your medicines and supplies to, and how are you involved in those situations right now?
Would you repeat that question?
Yes, sorry. So shifting back to what's happening right now in the world, what's happening in these countries that you ship to, and what does the situation look like there, and how are you involved in all of that?
Regarding COVID-19?
Yes.
Okay, good. MAP was one of the first organizations to respond. Back in January, when we first heard about COVID-19 really coming out of China, Wuhan, China, we were very fortunate to have literally millions of N95 masks that pharma companies like 3M donated, Henry Schein, Partner Health, all these companies that donated these supplies. We had them in our warehouse in Brunswick, which you visited a year ago.
Yeah.
And so we had them in supply already. So when we heard that they were in dire need of N95 masks and personal protective equipment in Wuhan and gloves, we literally working with UPS shipped in January, and then also in February with DHL, Friends of Wuhan out of California. Total, we shipped over 3.2 million N95 masks into China, and that was all for free. We gave to them for free, so help in the spread of the COVID-19 out of Wuhan. Unfortunately, we didn't realize 2 months later that we will be needing those masks just right here in the United States to help protect our own healthcare workers who are on the front line to help combat COVID-19 and also save lives. So it's really, we didn't think it was going to be this bad. Fortunately, we gave most of all we had to them. So now actually we have to purchase from Chinese manufacturers at KN95s for $3 a mask.
Wow.
But giving away 3 million masks in January and February of N95 masks. But, we believe that at the time they needed help, so we provided, airlifted it, so they would have it right away so they could help combat the spread of the coronavirus in Wuhan. And now we're trying to help our own neighbors and healthcare workers, hospitals, so we're raising money to purchase the KN95 masks, multi-use face shields, gloves, the protective equipment that we sorely need in the U.S. But also we're preparing for the onslaught of the COVID-19 in Africa. It's starting there on the curve, whereas we're plateaued and hopefully coming down in the United States. It's really beginning in Africa, so we're trying to get ready for that.
Wow. And, I actually thought about that because I watched when you were giving masks to China and everything. And my thought was that, we might need it in America or other places around the world. But unless we can stop it and try to do the best we can at its source, then we can't, help anyone else. And so I think you never know. I think putting those masks there where they were needed most of the time is really, like you said, was the best option. And anyway, I think that was great, and I love to hear that you're still trying all you can, even if you can't get them donated, to now be raising the money to purchase them.
And MAP was very fortunate to have all these items long before we even knew we needed them. And our philosophy is we help right away, and we help anybody, anywhere. And so we didn't keep that back because we just thought, hey, China, they need it badly because it was only in Wuhan at the time. Yeah. And but now we also are, if I can just name some of the organizations that we're helping through in the United States, Salvation Army is one. There are many places in the U.S. We have provided them, and Cardinal Health has been a great donor to MAP. They've given us literally truckloads, thousands of pallets of these hand wipes, which are critical. If you can't wash your hands with soap and water, these hand wipes will help keep your hands clean. So in some places on the streets and different places, you don't have soap and water. So the Salvation Army, we provided them 200 pallets. And those are being distributed to Arizona, California, Colorado, Florida, Georgia, Illinois, Indiana, Michigan, Missouri, Nebraska, New York, Washington. Convoy of Hope, another partner, 150 pallets of these hand wipes. World Vision, I used to work for them many years ago, 150 pallets of these hand wipes. And so we have also provided 100 additional pallets. And pallets are 4 by 4 by 4, so there's a lot of products in a pallet. And those masks, gloves, eye protecting, like glassware to protect the healthcare workers, also to senior care facilities, first responders. So we try to provide everything we can to the U.S. as well. And internationally, obviously, we have our partners that distribute them all over the world as well.
Yeah, wow. It's hard to conceptualize that many pallets going out with little hand wipes. I mean, that's a lot. That's a huge impact in just one small piece of how this is affecting people. It's amazing. So thank you. Thank you so much. So can you share too, because I know that this isn't the only crisis going on in the world right now, and they really compound on each other. But what other types of things do you respond to, or do you respond? I think you respond outside of crises too, just in general. Like health is a crisis at any point in time.
Yeah, you're absolutely right. And the news is 24/7 about COVID-19. But right here in the U.S., a couple of weeks ago, even last night, we had tornado coming through, and I think killed about 6 people recently. So we have these disaster health kits, and it provides them with a bag of toothpaste, toothbrush, shampoo, first aid kit, and washcloth, those kind of things to help bring a little bit of humanity back to people who are suffering through these disasters. And I'll give you some examples. Earthquake. People haven't heard about that, but recently there was an earthquake in Puerto Rico. Food for the Poor and our Project Hope provided 8,000 disaster health kits to their Convoy of Hope. We provided 2,000 disaster health kits in the tornado area in Tennessee. So those are still going on, and there's always, obviously, poverty is always every day. But then there's other disasters that happen throughout the world. Philippines, you have I think they had some different types of they have typhoon going on, and so it's always things you don't hear about it. Here's the one in Philippines, 40-foot container that's 160 pallets of supplies, including 3,000 DHKs, 100 water filters to help following the typhoon and earthquake and volcanic activity. That was a little while ago. The Bahamas, following the Hurricane Dorian last year, we still provide some relief efforts there. So unfortunately, anywhere in the world, there's always some disaster going on. And so MAP responds to disasters through our partners on the ground. That's why we're able to respond so quickly, is that we have partners on the ground, and then ongoing due to chronic diseases.
Wow. Well, Steve, MAP is one of my favorite organizations, and I get to talk to a lot of organizations, and I think it's a combination of your model, like you just said, working locally, and even other things about your model that we didn't even get into today, and then just the efficiency, and even probably most importantly, just the people in your organization. So having a team of 40 people and serving 10 million people around the world in a year, and knowing you're doing that work, but then also I know personally how much care you give to just talking to people about what you do, and I've experienced that in numerous phone calls and messages, emails, and everything. And so I just love what you do, and that's why I wanted to be able to share that with others. I know that you also, I don't even know what the rankings were, but just recently I read that MAP ranked in two different areas or two different places about your response in the COVID-19 crisis. And I think just again and again, those things continue to come up. So anyway, thank you for everything that you're doing to keep us safe and everyone else around the world safe.
Thank you. I really appreciate your support and all you do to help share these stories to help all humanity around in the U.S. but around the world too.
Yeah, and before we go, I want to, because some people might be in the same boat as me, like, this organization sounds really, really great. How can I get involved? And I know that this is a sensitive time too, so for some, it might not even be on the radar to be able to jump in and help right now, and definitely understand that. But if there are people who would like to, can you share how we can get involved with MAP right now?
Well, I'll be happy to. Thank you. And we understand these are challenging times for everyone.
Yeah.
And so please don't feel that by you need to donate anything. But just to share with you, go to www.map.org. That's map.org, and you can get engaged in a number of ways. And again, even like a $10 one-time gift that will provide $840 worth of medicine, because the medicines are donated to MAP, and the $10 helps us with the shipping costs, our operational costs, and whatnot. So, and also just to really get the word out about MAP, share with your friends and share. Just get the word out, because most people don't know about MAP, and that's another big way you can help. And when you can get out, obviously you can volunteer. Where it happened to be in Brunswick, but we're opening up a small distribution location in Decatur, hopefully in the next, up in Tucker actually, in about 6 months, once the COVID-19 dies down. And so get involved that way, and just pray for us, just pray for the people that we serve. Mm-hmm. And also, if I may just talk about my book a little bit. Yes. It's called The Crutch of Success. And it's just about my story and how God can use anybody, even a handicapped kid from Korea, from the orphanage, and talks about that, and also talks about MAP as well. And so if you'd like to get a copy of my book, you go to map.org, or it's also available on Amazon. And so just anything to get the word out will be greatly appreciated.
Yeah, I'm glad you mentioned your book because that's something that I've shared with quite a few people already, simply because it's such a great story and testimony of how God works in people's lives. And I mean, you alluded at the beginning that you're on crutches and all that, and just your own health journey and bringing you. It's just such a God story, and so I think it's just a story to encourage a lot of people. So anyway, love that too. Before we go, can you just give us a little insight into how you think humanity might end up growing through this situation that we're going through? Like, who are we becoming as humanity?
Well, that's a very insightful question, Stephanie. You're asking, and I have to think about that. But if you think about this event that's happening, and nobody foresaw it happening, nobody saw it. That's going to impact the whole world. It's where literally, I think it's close to 200 countries around the world, and for the first time, and hopefully it'll be something like this will happen in our lifetime. But if you look at the silver lining, is that we all, as humanity, are getting together because we're trying to uh, uh, fight against this one unseen enemy, the virus, and everybody getting together. And if you look at why young people are staying home, they may not get it and they're healthy, but at the same time they're staying home because you don't want to catch the virus and unknowingly pass it to your grandmother or grandparents or elderly person that is old and might be more susceptible to passing away from COVID-19. So I think it's the first time we're getting together as humanity, and I hope people will remember that most of the world, they do not have access to healthcare, to clean water that leads to good health, and prenatal vitamins. Example, women, the 1.2 billion women in the world that will have hypertension, and oftentimes that's during pregnancy. Things like that we don't think about, and so those kind of things. Hopefully, people will remember that when we have something, most of the world does not have it. And I hope that we can always, throughout this painful process, remember how fortunate we are. And yes, I know there are many people in the U.S. hurting right now because of loss of job and healthcare. And just when things go back to where we are healthier and whatnot, that we don't forget the rest of the world who don't have access to food, water, medicines, and whatnot. So I think it's a good reminder that we're all living in this world together. We have to take care of the planet. We can't go pollute all the time. God gave us one Earth, and we have to take care of it, be good stewards of it, and of each other as well.
Yeah, that's beautiful. I love that, and I've been thinking a lot about that too. Just how beautiful this world is, and the people are within it, and how we can have an opportunity to continue coming together and saving both world and us at the same time. So, Steve, it's been just a pleasure to be able to talk to you today, and I know we'll be in touch more throughout all of this, but thank you for taking the time to talk a little bit about MAP and share a window into what's going on around the world as it relates to health right now and how you're involved in all of that.
Thank you very much, Stephanie, for all you do. I really appreciate you and your family, and you're caring for people right in Atlanta, Georgia, in the U.S., and all over the world. So thank you for what you're doing.
Thank you, Steve. Have a great rest of your day. Wow, I loved what Steve said about how this is a time where our world has the opportunity to come together and in solidarity and in serving each other and also taking care of our earth. And I think they are a great example of coming together in just what they shared about how they were one of the first to respond in China when the COVID-19 virus broke out, and they gave everything they had stockpiled for a long time and ready and available to them in an effort to serve the world. And they don't take alliance and allegiance only to one country, but they serve the entire world, including our country. And I think that's just a beautiful testament of where their values lie and the model and the mission that they operate under. So if this video touched you in any way, or you're wanting to learn more about MAP, or you're excited to share about MAP, please do share this with someone that you care about, a friend that you think might like this. But also there is so much more to uncover, and I hope to be able to share more about MAP. Well, I will. I'm sure I will, because I really do love them. But I'll be sharing more as time goes. But his book, The Crutch of Success, is truly incredible. It's an amazing story. And anyway, I would love to hear if you have thoughts or comments on this video. Please do that below, and I'd love to talk to you more about all of this. And if you'd like to receive and notice when the next video story comes out, please go to my website, lovelightstories.com, and you can sign up there, and you'll get an email the next time a story comes out. See you next time.